who's been pitching in to bring you information on the impact of the COVID-19 pandemic on Mobile County and our vaccination efforts. So just a little bit of information. Worldwide, there are greater than 125 million cases of COVID-19. In Alabama, we're nearing 514,000. And worldwide, there are nearly 2.8 million deaths from COVID. In Alabama, just over 10,500. So today in Mobile County, we're reporting on 37,528 cases of COVID-19 that have been reported to us since March 19th of 2020. Yesterday, 16 cases were added, so we still are seeing just an extraordinarily low number of COVID cases detected and reported to us. One additional death was reported to us, bringing our total number of died with COVID to 788. And the cumulative number of patients hospitalized in Mobile hospitals with a COVID-19 diagnosis increased 7 yesterday to 4,806. So when we look at the number of people hospitalized yesterday with COVID-19, we are missing at least one report. So the number yesterday was 10, which will sort of right itself, I think, after that hospital maybe reports. We cut the report off by 1 p.m., so they had not gotten their report in yesterday by 1. But if we, it looks like they're still, in the mid-20s hospitalized with COVID right now in Alabama hospitals. So there are just a couple of questions that I'll get to before we talk about vaccine and staying safe during Easter and spring break. So lots of conversations ongoing in the media and at the water cooler about vaccine hesitancy and why people are reluctant to get COVID vaccine. And this is something that, again, is what we're trying to deal with, to try to give people the information that they need to make a good decision for themselves and their families. We've all had vaccines. We've all taken vaccines. Most of us got, vaccine when we were very young. Maybe if we didn't get them when we were young, when we were entering college, maybe on the job site, if you got injured and needed a tetanus shot. Many diseases have been cured with vaccines. Smallpox, measles is nearly eliminated from this country, though we still see travel-associated cases, people who travel to areas that don't have high vaccination rates for measles. So there are lots of examples to show where safe and effective vaccines, if used widespread, so if they're used throughout the community, we can reduce and eliminate sometimes very deadly illnesses. So sometimes people are resistant because it's a new vaccine and there's a perception that it was developed really fast. And there's some truth to that. The manufacturers did stop doing everything else to really work on COVID vaccines, but the technology that these first vaccines are built on have been, in the works for many, many, many years. So I can understand why people might say, well, gosh, it was just developed in a year. How can I trust it? I'm just going to, wait and see what happens. And so we hear that quite a bit. And sometimes, as friends or coworkers or family members see, someone in their peer group that's been vaccinated, that was safe, and that doesn't have to wear their mask. Maybe if they're around a family member, other vaccinated people, they don't have to isolate if they've been vaccinated. Then some of those things, I think, will start to break down this barrier that this is not a mutant piece of genetic material that is going to, make you grow a third ear. But these are safe and effective vaccines. Also, I think, sometimes emotion drives hesitancy to take the vaccine. Maybe people being afraid or angry about injustices in the past when it comes to the medical community and different social, ethnic, cultural groups. So we are trying to help allay fears and, try to help people make calm, fearless, trusting decisions about this vaccine, and really, just trying to emphasize that, a safe and effective vaccine could save your life. It could save the life of your parent or the life of your child that maybe has diabetes, for example. We're all tired of COVID-19 pandemic, but it's not going away. Yes, it is very low, but it is still here, and it can rear its head anytime, as long, if we're not continuing to get vaccinated and to follow the public health measures. So, we all want to do our part to keep our community safe. And again, the virus is scarier to me than the vaccine. So I have more fear around, my grandmother getting the virus and the severe illness and potential death that could cause her. That puts more fear in me than her getting the vaccine. And so, I just want to be able to visit her and love on her and, have her be around her children and grandchildren. And so these, getting families back together, it really is going to depend on continuing to practice the social distancing, wearing your mask, washing your hands, covering your cough, staying at home if you're sick, and getting vaccinated. It really is. Let's set a personal goal. Let's try to get 80% of the population in Mobile County vaccinated before the 4th of July. Wouldn't it be great to have a safe 4th of July with some small, family gatherings if you have, a fully vaccinated group? And who knows, maybe if we all sort of, can commit to getting vaccinated, we might be able to have, full football stadiums in the fall. Who knows? But we won't be able to get there if we don't have everyone's participation in getting vaccinated and in carrying out these public health measures. All right, other questions. How is the percent change in cases calculated in regards to figure 9 on the weekly chart? So this question, if I'm understanding correctly, is about, Mark's telling me which way to point. This chart, number 9 in our weekly report, and it's the number of COVID positive laboratory tests by week. This is not the number of COVID cases by week. So the navy and gray bars indicate positive and negative test results, the number of positive test results, the number of negative test results reported to us. The line that has the percentages is the percent positive laboratory tests. So the 4% for the week ending March 14th, I guess that's the week starting March 14th, that 4% means that of all the tests reported to us that week, 4% of them were positive. So that 4% is not a change in cases calculated. Figure 9 has nothing to do with cases. It's about test results. So hopefully that explains that. Let's see. Someone asking about the validity and the accuracy of rapid tests. So we know that the rapid antigen tests are slightly less accurate than a PCR test, but they have immense value because they are rapid and you can get a test result in a very short time. What we have done to overcome this slightly less accurate situation is if you have symptoms of COVID and you test negative on a rapid test, then we do a PCR. Or if you don't have symptoms of COVID and you've not been exposed to anyone with COVID and you test positive, then we do a PCR. So that's how we are taking, the great value that comes to us with getting a test result in 15 minutes, 20 minutes, sometimes an hour, and making sure that we're getting the best and most accurate result by following up with PCR when we think that the rapid result might not be correct. Let's see, someone saying they had their annual physical this week and at check-in was asked if they had received a vaccine in the past 14 days. So, and someone's saying, why is this question being asked at the doctor's office? So I'm not completely sure. You might want to ask your doctor about that. But my guess is that for the COVID vaccination, we recommend deferring COVID vaccination if you have received another vaccine within the last 14 days. So it may be that they're just trying to establish if you are eligible to receive a COVID vaccine or not. So those are the questions that we have. We're going to talk a little bit about the vaccine events that we have going on. And this week, you might have seen the Alabama Department of Public Health and the National Guard partnered together. The National Guard has been using federally funded vaccine and providing vaccine out in, I think it was 27 counties, very rural counties that don't have community health centers or don't have hospitals, and some of them may just have one or two pharmacies, and there is less vaccine available because of that. So the National Guard this week has been doing a lot to try to get out COVID. And starting Monday, very exciting, the State Health Department is receiving an additional, I believe, 20,000 doses of Pfizer vaccine. And they're going to try to get it out in 1 week through events at the 8 public health districts in the state, of which Mobile is one. So we are our own district. So it's very exciting that the Mobile County Health Department has received Pfizer vaccine. We waited a long time to get our -80 freezer delivered to us, installed, running, approved for holding Pfizer vaccine, and we're very excited to report that that has happened. So because of the extra push, we were able to get quite a bit of Pfizer vaccine for use next week in this big push in the 8 districts. So listen closely. These are where we will have clinics. Tomorrow, there is a second dose clinic at the Redemption Church in Saraland. So these are for people who were previously vaccinated at the Redemption Church in Saraland. So again, this is tomorrow. Moderna second dose only for people who were previously vaccinated by the health department at Redemption Church in Saraland. And then every day next week, Monday through Friday, the health department is going to be running COVID vaccine clinics at that Mobile, Alabama cruise terminal every day next week, Monday through Friday. So listen closely to the times. On Monday, we will be offering Moderna first dose. This is all these are first dose clinics that I'm about to talk about. So cruise terminal at 8 o'clock until 4, Moderna first dose. And then we are going to be switching, for next week at least, our cruise terminal to Pfizer doses. So Tuesday, March 30th at the cruise terminal from 8 to 4, Pfizer. First come, first serve, no appointment. Wednesday, March 31st, cruise terminal 8 to 8 p.m. So if you work during the day, we're providing several opportunities for you to get vaccination after work. So on Wednesday, cruise terminal 8 a.m. to 8 p.m., Pfizer first dose. Thursday, April 1st, noon to 8 p.m., Pfizer first dose. And then Friday, April 2nd at the cruise terminal, 8 a.m. to 4 p.m., Pfizer first dose. So there are, it's all at the cruise terminal. They start at 8 o'clock, except for Thursday, they'll start noon. To be sure, check our website at mchdcares.com. We will have, graphics there to make sure you know what is available, or you can call our telephone recorded message at 251-410-MCHD. So that's very exciting. 5 days a week, COVID, vaccine, first come, first serve. And remember, the eligibility criteria right now, anyone 55 and older can get a COVID vaccine. Anyone over the age of 16 or 18, depending on what vaccine you get, with underlying medical conditions can get a COVID-19 vaccine. You do not need proof of your underlying medical condition, okay? So if you come to get vaccinated and they ask you, hey, do you have any of these underlying medical conditions? All you have to do is say yes, and you will be allowed to get vaccinated, right? We have plenty of vaccine next week, so please come to the terminal to get vaccinated. And then, of course, there are lots of other 1A, 1B, and 1C categories of people who could get vaccinated if you're under the age of 55 and you don't admit or report that you have an underlying medical condition. Again, we don't need to know what it is. Just say, yes, I have an underlying medical condition, and get vaccinated. If you're coming as an essential worker, make sure you bring your ID or check stub or your badge, something like that. ID, badge, same thing. Bring some documentation that you are in that 1A, 1B, or 1C category if you're in manufacturing or something of that nature. All right, the last thing I want to talk about before letting you go today is the continued importance of avoiding gatherings over the coming holidays. So I've been watching closely. Dr. Eichel has been watching closely, all of us have, with what's been happening in Miami Beach, with scores of people showing up for spring break and other celebrations, and just creating, a super spreader event. It is a fact that large gatherings increase the risk of COVID transmission. So please, if you are traveling during spring break, if you're going to one of our beautiful beaches, if you're going to the island, if you're headed to Florida, if you're going to Disney, whatever you may be doing for spring break, I would ask you to do a couple of things. Get tested before you go. Know your COVID status. Anybody can get tested at the health department by calling 690-8889. There are lots of other places in town where you can get tested. Avoid gatherings, right? If you're traveling with your family, keep your family protected and away from other groups that may be traveling to the same destination. You have no idea where they have come from, and you have no idea what their behaviors have been like. So to protect yourself, keep your household intact and protected. Maintain distance. Do not get yourself into a situation of being, around large gatherings where there are people from a lot of other places that may have higher rates of transmission than we do in Mobile, and that may not have been protecting themselves. They may not be vaccinated. So again, let's try to, set a model for what time at the beach is like, what travel should look like, what spring break can be. I'm not saying don't do it, but do it wisely, and, remember those prevention measures to protect yourself, and let's try to keep our beaches out of the news during spring break. And the same goes for Easter. Lots of gatherings coming up, outdoor Easter egg hunts, which are great. Outdoors is better, remember. Try to shorten your gatherings. Try to have them outdoors if you can. Remember, if you are fully vaccinated, that's where we all need to be, a fully vaccinated person. So if you are around other fully vaccinated people and you're distancing and wearing your mask, that is the most you can do to protect yourself. So please get vaccinated, continue to wear your mask, avoid gatherings, and try to keep yourself, your family, and our community safe over the coming holidays. And I will leave it there for now. We will be back on Monday afternoon. Not sure if we'll be here or if we'll be at the cruise terminal, but we'll give you an update next Monday and Friday. Have a great weekend. Please stay safe in the weather. Don't drive through a road if it's covered with water. Stay safe, everyone, and we'll talk to you next week. Bye.